The history of acupuncture goes back thousands of years, and like a lot of things, topics of Chinese medicine, the further we go back, the less evidence there is. But the original acupuncture treatment was done with what were called biang stones, sharp instruments. Sometimes the stings of insects were used. People often ask, well, how did they figure out where the points are? Well, part of that came from just rubbing a sore spot. And as a person rubs a sore spot, massage it, it's a little bit tender up here. And the idea is that these channels, meridians or channels, were located by such a means, if not through some kind of intuitive process. But piece by piece, the points were also located on the channels, and then these variety of methods were used, from pressure to, as we mentioned, insect stings and needles, bronze needles. Sometimes it was just a blunt needle, so it didn't actually pierce the skin, but it stimulated the point. But piece by piece, acupuncture has evolved, and in the north of China, a heating, warming technique, burning moxa in close proximity to acupuncture points evolved and gradually spread south, whereas the needles were understood to come from the south and that spread north. These days in my own practice, if I want to have a stimulating effect, I use more moxa on acupuncture points. If I want to have a relaxing, sedating effect, I'll use more needles. And so this is what acupuncture is all about, is balancing. We could call it meridian therapy, really. And so anything that stimulates, helps to balance, restore the flow of energy through the body, we could call meridian therapy. So acupuncture is one of those means. The typical acupuncture treatment, following the diagnostic procedure, the client's lying down, either face up or face down, depending on what we want to achieve, and sometimes sitting, depending on the client's comfort and which parts of the body we want to access. We typically swab the acupuncture point with a alcohol swab, and then a needle is placed into the body. A very, very common question, of course, is, does it hurt? It's very difficult to insert a needle into the body without causing some pain. In China, there's an emphasis on getting what's called de qi, which means the arrival of qi. And that can sometimes be quite a painful procedure. If a heavier gauge needle is used, it's going to generally be more painful. On the other hand, almost diametrically opposed, Japanese acupuncture uses extremely fine needles, very, very shallow insertion depths, and they'll often say that acupuncture can be quite painless. I think there's always going to be some degree of pain. The style of the acupuncturist's training and their style varies from practitioner to practitioner. I personally like to take into consideration the client's sensitivity. If they're very nervous, I like to use very gentle methods. If it's a sporting injury, the person's quite big and strong, we might use some stronger methods. But basically, that's how we go about. 99%, I would say, of my clients at the end of their first acupuncture treatment all say it's much easier and less painful than they imagined. So acupuncture can be a very, very useful and successful method of treating a large range of problems. So I can highly recommend it. I always have acupuncture myself, my family, friends. And it's a great system. try it if you haven't done so.